So my talk was on the bronchodilators in patients with cardiovascular disease. As we know that inhaled bronchodilators, even though they're supposed to work in the lung, but they may have an effect outside the lung, particularly on the cardiovascular system. Both beta-2 agonists and antimuscarinic agents, which are the strongest bronchodilators for both asthma and COPD, may have some adverse effects in outside the lung, particularly in the heart, because the heart muscles have receptors for these agents. Although in normal individuals, adverse effects from the inhaled bronchodilators are very minimal. In patients with underlying cardiovascular disease, such as patients with heart failure, previous myocardial infarction, or arrhythmias, clinicians should be careful because there are reported cases of increased risk, cardiovascular risk, with the use of inhaled bronchodilators. There's no difference between whether it's a beta agonist or anticholinergic. There's some emerging data suggesting the combination of the both beta agonist and antimuscarinic may have an increased risk of heart failure in patients with underlying disease, but these data need to be further examined. However, on the other hand, there are some potential benefits of inhaled bronchodilators on the heart because they reduce the hyperinflation that occurs in the lung and therefore may improve cardiac function. Although this is more seen in small studies right now, larger studies are needed to confirm this. Finally, there is some potential interaction between the inhaled bronchodilators and other drugs given for patients with heart disease, such as beta blockers. In fact, some studies suggest that inhaled bronchodilators, especially beta agonists, when given with a beta blocker, the risk of adverse effects are lower. And again, that also observation needs to be further studied. So in summary, inhaled bronchodilators are fairly safe in the general population in patients with no risk, but in patients with underlying cardiovascular risk, clinicians have to be careful in monitoring their patients with the use of both inhaled beta agonists or inhaled antimuscarinics.